Namaskar viewers, hello and welcome to this special broadcast on Sansad TV. I am Tina Jha. September 2023 marks major milestones for two flagship health schemes of the Modi government. The Ayushman Bharat Pradhan Jan Arogya Yojana, which completed 5 years since its implementation on 23rd of September 2018, and the Ayushman Bharat Digital Mission that marked its second anniversary since its launch on 27th of September 2021. So since its inception, the Ayushman Bharat PMJAY scheme, the world's largest government-funded healthcare program, has been setting new definitions of success every year. It has achieved new milestones, crossing 5 crore plus hospital admissions, while the Ayushman Bharat Digital Mission continues to build an efficient, interoperable digital health ecosystem with active participation from the public as well as the private sector. Ayushman Bharat Digital Mission has accomplished in creating 43 crore plus Ayushman Bharat health accounts and linking 28 crore plus health records. Another significant step towards achieving universal health coverage has been the launch of Ayushman Bhav, a campaign launched by President Draupadi Murmu earlier this month. What are the objectives of this campaign? How will it ensure the goal of delivering healthcare services to the last mile of India? The success of Ayushman Bharat in transforming the health sector, the opportunities it provides, also the challenges that we still need to overcome in this particular sector. We'll talk about all of these aspects with a special guest joining us on this broadcast. It gives me immense pleasure to welcome on Sansad TV Mr. Sudhansh Pant, Secretary, Ministry of Health and Family Welfare, Government of India. Sir, delighted to have you with us on this broadcast on Sansad TV. Thank you for your time.
Thank you, ma'am.
To begin with, since the Ayushman Bhav campaign is currently underway, for us and our viewers, explain to us what are its aims and objectives, what has been the vision, the idea behind the Ayushman Bhav campaign?
Yes. This Ayushman Bhav campaign, when it was conceptualized, the objective was that health services at every level should get saturated. So far, the government has already reached down to the primary level of health services. Now, we are trying to saturate at every level. Every service should become available. No person should be left out. So that was the basic concept. So as you mentioned, it was launched on the 13th of September by Honorable President. It rolled out in the states in the field from the 17th of September. So the first 15 days from 17th September till 2nd October, we are calling it the Seva Pakhwada. But the campaign will run till 31st December. So there are 7 broad pillars of the campaign. The first is the Ayushman Melas or the camps are going to be organized at every health and wellness center. We have more than 1.6 lakh health and wellness centers across the country. These are the primary healthcare units where there is one community health officer, one A&M and one other nurse, and 13-14 types of basic diagnostics and screening happens in these primary centers. So there is going to be one Ayushman Mela at each one of these health centers every week till the duration of the campaign. And there's also going to be Ayushman Mela at the level of the CHC, which is the Community Health Center, which is a larger unit, mostly at the block and tehsil level. So this is the first component, having Ayushman Melas. In these Ayushman Melas, more services, more screenings, diagnostics will be available than what is normally there. For example, at the CHC level Mela, the doctors and specialists from medical colleges are going to come there. That means tertiary level of expertise is going to become available at the secondary level, which is the CHC. Likewise, at the health and wellness centers, which is the primary level of care, the secondary level facilities are going to be made available. Those screenings and tests which are not there normally at the primary level, they are also going to be conducted there during the campaign period. So this way we intend to saturate all the possible patients and all kinds of services. Second pillar is the Ayushman Sabha. In every Gram Panchayat and every municipal ward, there is going to be an Ayushman Sabha. In the Ayushman Sabha, they are going to identify the beneficiaries, which of the beneficiaries have been saturated with the service. For instance, somebody's Ayushman card has to be made. If a beneficiary is left out, she or he will be identified and they will be given a card on the spot. Likewise, The beneficiaries list can also be verified, and a lot of other services. People will be asked if anybody has any health issue, it will be attended to. The third pillar is having a blood donation camps along with these melas. Fourth is getting people to pledge for organ donation. Organ donation, very recently, the ministry has come out with a portal which is very user friendly. One can pledge organs in about 1.5 to 2 minutes online, and this is a major component of our campaign, Ayushman Bhav campaign. The next component is the making of Ayushman cards. So far, under the Pradhan Mantri Jan Arogya Yojana, PMJAY, we've already made about 25 crore cards. A recent development is that earlier this card could not be made by every beneficiary using the app. Now, this app has been made available, and there is a process of self-verification. Any beneficiary can himself make his own, generate his own card on his phone, or anybody can do it on his behalf on self-verification basis. Now there is no need to get it ratified by some higher authority or go to the state health agency and all that. Okay. So making of these Ayushman cards is one of the very important pillars of this campaign. Then generation of the Abha ID. Abha ID is a unique identification number which is given to every citizen. It is the short form of Ayushman Bharat Health Account, AB-PMJAY ID. So Abha ID generation is also taking place during the campaign. And last but not the least, we've kept a component of Swachhata. Cleanliness, sanitation, healthcare facilities will be cleaned regularly. They'll be in the best possible space as far as cleanliness is concerned. The health facilities, as it is, they're supposed to be very clean, because people come with all kinds of diseases, and we would not want any infection to reach them through the premises.
You spoke about the 7 pillars. It leads me to the next question, sir, about the organ donation. This is one area where India needs to really work upon hard. According to the Health Ministry's own data, the number of donors, which includes the deceased, grew only from 6,916 in 2014 to about 16,041 in 2022. The numbers clearly reflect India's paucity of organ donations. So towards, and because the effort in this campaign is to increase awareness about organ donation, what are we particularly doing to increase awareness, to ensure, to convince people that you need to come out and donate organs, because one human body can save at least 8 human lives?
That's very true. Today in India we have an imbalance in the sense that the supply of organs is much less than the demand. And that is why when this campaign was being planned, we deliberately brought in organ donation as one of the pillars. Organ donation, people are making the pledges even in the states. We have a setup in the sense that there is a national agency which is called the NOTO, and then most of the states have their separate agency which is called the SOTO, State Organ Transplant Agency. So many of the states were getting a lot of pledges, but they were not being linked to the Aadhaar number, and so those registrations were not reflecting at the national level. So very recently, just last month in August, a portal has been designed, which I also mentioned earlier. It is very easy to use. It will take the user hardly 1.5 to 2 minutes to pledge any organ. They can pledge all the organs, or they can select from a menu whether they want to pledge the eyes, just the kidney or the liver or whatever part. So this portal has been launched very recently. It is picking up. Even through this medium, I think a lot of people get to know about this portal for organ donation. One of the biggest challenges in organ donation still remains family consent. Even after a person has passed away, if the family members are not aware that the deceased has earlier pledged his organs, they'll find it very difficult to let go of the patient, let go of the person, and he will go to a hospital, and for some amount of time, then they will do the surgery, whatever, they'll take out the organs. So apart from just the pledge of the organs, the sensitization, awareness creation amongst the family members, that it was not too intrusive. Even if an organ, say the corona has to be taken for transplant from the eyes, it is not going to damage the body as such. Even if the kidneys have to be replaced, it is not going to damage the body too much. And it is done within a very short time. So those are the critical factors. So it is true, organ donation is one of our major challenges. That is why we've kept it in this campaign, and very happy to say that in the short while of about a week or so, we've already got 16,000 plus organ donation pledges in this portal. Even now, many states have got many times higher pledges, but the state portals are not yet fully linked to our national portal. So we are trying to link all these portals so that the national data as a whole becomes available.
One data.
Yes, one database with all Aadhaar numbers, all identification addresses, phone numbers, and then in a sense the actual national platform will get created.
So along with the Ayushman Bhav campaign, the Ayushman portal was also launched by the President on the 13th. How is the Ayushman portal facilitating the process of strengthening these components that you've spoken about?
Yes. Ayushman portal is basically a monitoring kind of dashboard where on a real-time basis all that is happening in a day across the country in this Ayushman Bhav campaign, it gets reflected. How many footfalls have taken place, how many camps are being organized, how many people have done the blood donation, how many units of blood have been collected, how many cards are being made. All this information, all details, state-wise, district-wise, health facility-wise, I mean, you can go into as much detail as you want. So all this is available at the touch of a button on a real-time basis. So it helps in monitoring. Anybody, it's open to the public, it's in the public domain. Anybody can come to this dashboard on this portal and see for herself what all is happening. If somebody is interested in her particular city or village, they can also go and see what is happening in that particular place.
Right. So it's clearly a significant step towards achieving the goal of universal health coverage, which has been the larger aim of both these schemes, the flagship schemes that I introduced in the beginning, the Ayushman Bharat PMJAY and the Ayushman Bharat Digital Mission. How have these two schemes been faring? How have these two transformed the Indian health sector?
Yes. So the Ayushman name remains the flagship name for the health sector schemes in the last 5 years. So in 2018, when the Ayushman Bharat campaign was launched, Ayushman Bharat was launched by Honorable Prime Minister, there were two components of Ayushman Bharat. One was this health assurance scheme, which is Pradhanmantri Jan Arogya Yojana, PMJ in short, which is that 5 lakh rupees of free hospitalized treatment to a poor family in 1 year. So this is the largest health assurance scheme in the world, and 12 crore families are in the beneficiaries list. Nearly 60 crore individuals are covered under this scheme. So this was one component. The other component was Ayushman Bharat Health and Wellness Centers. These are the centers at the primary level. As I said, we have more than 1.6 lakh of these health and wellness centers, mostly at Gram Panchayat level, and these are providing basically primary health care with 13 to 14 kinds of testing, diagnostics, even some preventive things like yoga twice a week and some other fitness activities and all. So initially in 2018, these two components were there. Subsequently, 2 more components have been added to the overall Ayushman umbrella. Third one is Pradhanmantri Ayushman Bharat Health Infrastructure Mission. Post-COVID, it was realized that maybe there are some infrastructure gaps in our healthcare facilities to possibly face some health emergency in the future. So 65,000 crore rupees were set aside for this PM-ABDM, which we call in short, infrastructure mission, to enhance, to create more infrastructural facilities right from the block level, from the block public health units to the district level, to the tertiary level, highest level, where critical care blocks are also being set up. So, apart from setting up highly equipped laboratories, public health laboratories in every district, so that all kinds of testing, diagnostics, testing for infectious diseases, all kinds of things could take place. So this is a very major mission, and by 2026, all these projects have to be completed. 65,000 crores, a huge investment, highest ever investment government has made in the health infrastructure sector ever. So this was the third component. The fourth component, which was launched 2 years back, is the digital mission. It is called the Ayushman Bharat Digital Mission, ABDM. Digital mission, the concept is very simple. Every citizen should have a unique health ID, which we call the Abha ID. All her or his health record should be digitized. It should be available. Instead of carrying around bulky reports and people not able to preserve or save their earlier records, or even the prescriptions, even the consultation charts, everything will be digitized, save against that Abha ID. So far, I am very happy to say that 45 crore Abha IDs have already been generated out of about 140 crore which we need to reach. The second component of this digital mission is we have to create a health registry for all health professionals, starting from doctors, nurses, dental, pharmacists, allied healthcare professionals, everyone. So that every health professional is mapped digitally. So far, we have reached about 3 lakh, still long way to go, but it's an ongoing process. The third registry which is being created is a registry of all the healthcare facilities in the country, from the biggest of hospitals to the smallest of diagnostic centers, whether in the private sector or in the government sector.
So in terms of outreach, in terms of strengthening infrastructure, a lot is being done, and as you rightly spoke about these schemes. But what about the other biggest challenge that the Indian sector has been reeling under for several decades is the shortage of medical professionals. So infrastructure is of course the first big step, but what efficient steps are we undertaking to ensure that this particular challenge of shortage of medical professionals, to ensure that our health systems are resilient, we are prepared for any other future shock like the COVID, so we don't have to look towards some other challenge? How are we preparing ourselves?
Yes. The two basic structures in the healthcare system, one is infrastructure, one is the human resources. So a lot of focus has gone into the human resources in the last few years. Without going into the statistics, I'll just tell you, like, for instance, the number of MBBS seats, the number of medical colleges in the country. Till 6-7 years back, there used to be less than 60,000 MBBS seats. Today it is more than 1.1 lakh. So it's almost doubled in 5-6 years. Likewise, for the postgraduate medical seats, it used to be around 35 to 40,000 till 2015-16. Now it is at a level of 80,000. It's also doubled in the last 6-7 years. Not only doctors constitute a small part of our total health human resource. Nursing, we are producing twice or thrice as many nurses today as we were producing some 7, 8, 10 years back. Likewise, allied healthcare professionals, which is a very vast canvas encompassing about 54, 55 different sets of professionals. We club it together as allied health services, allied healthcare professionals. So in 2021, an act has come. Parliament has passed a bill, it has become an act, Allied Health Commission Act. So these allied healthcare professionals, which are nearly 10 lakh in the country, earlier they had no recognition, they had no formal system of registration. So that has been registered, that act has come. Recently, in the last parliament session in August, 2 of the pre-independence acts which were there, the Dentist Act of 1948 and the Nursing Act of 1949, both of them have been repealed. they have been replaced by new and modern acts. So, to encourage more dental professionals, more nursing professionals, more pharmacy professionals, more allied healthcare professionals, government is acting on all fronts. And the Pharmacy Act is also very old act. It is also under amendment. We very shortly, hopefully in the next session of Parliament, we are going to introduce a bill for amending our existing Pharmacy Act also, which is a pre-constitution act. So, human resources in health has been at the top priority of the government. We are doing all that is possible, and it is showing in the numbers. The ratios which have been prescribed by WHO for say 10,000 population, how many doctors should there be, how many nurses should there be. So, India's position has vastly improved. On many of these parameters, we are now at par with or even better than what WHO has prescribed.
And to further enhance performance, what is also required is, because health being a state subject, more cooperation between the center and the states. At the National Urban Health Conclave, you recently highlighted the pressing need for strengthening the primary and secondary healthcare network at the urban level. So in that aspect, if I could ask you, what role are the urban local bodies today playing in improving the state of the healthcare sector? And particularly if we also add to that the coordination between the center and the states to make that coordination seamless?
Yes. The urban local bodies in our country, we have, on the one hand, on one extreme, there are municipal corporations like Mumbai and Kolkata, which are running even their own medical colleges. So they are totally involved in the health sector, and they have a network of strong dispensaries. They have their own medical professionals. They are fully supporting public health activities. On the other hand, a large majority of the municipal bodies in this country, they don't have anything at all to do in the health. They have totally abdicated that responsibility to the state government. So we have the two extremes are there. In between, there are few municipal bodies in some states. Some states have delegated a lot of responsibilities. The municipal bodies have taken over a lot of responsibility, especially in states like Maharashtra and Gujarat. Their municipal bodies are financially strong. They have played an increasing role in the public health sector. But in most of the other states, the municipal bodies, for them, health only means sanitation, which means cleanliness. So even in this urban health conclave, we have urged the other municipal bodies to take health as an important part of their functions, apart from cleaning, sanitation. Some municipal corporations also supply electricity and drinking water. We have requested them that health should also become one of the priority items in which the municipal bodies can take over the responsibility from the state governments, and the budgeting could be done from the state government till such time that municipal bodies become financially strong enough to sustain a strong health and a medical cell in their respective municipal bodies. So it's an ongoing thing. We have both the extremes and we have all the range in between. So some municipal bodies are doing, they may have 1 or 2 doctors or some other staff. Some municipal bodies will not have any doctor. Some will have 1 doctor, but that person will only be supervising the sanitation and cleanliness part.
But the idea is to take the best practices to each other, and so that each can incorporate the best practices. If I may now ask you about the opportunities, sir, that the healthcare sector has created for the startups. India today is the 3rd largest startup ecosystem in the world, and especially after COVID, we've seen how a lot of startups have emerged in this particular sector. So how are we ensuring that we promote that kind of entrepreneurial spirit in the healthcare sector?
You are right in the sense that healthcare has been one of the sectors in which during COVID, a lot of people got interested. Maybe pre-COVID, the entrepreneurs were not looking at health with that kind of interest. But during COVID and post-COVID, the entire scenario has changed. We have a lot of these startups and these young entrepreneurs coming up with great ideas. coming up with products, prototypes. Government of India already has a different set of incentives for encouraging these startups. Health Ministry per se does not have anything different. We are just part of the entire ecosystem. So all the startups are getting encouragement from the Government of India. As far as we are concerned, we facilitate. Somebody needs some information, they need some real, they need hospital visits, they need some real-time exposure, they need some feedback about a particular equipment. So we always try and help and facilitate. We play a hand-holding role. The financial part of it, Health Ministry directly doesn't get into it, but it is being taken care of by the other ministries of the Government of India.
But the sector-specific requirements are taken care of by the ministry.
Yes, definitely.
I'll take one last question from you, because technology in our country has been a great enabler of the kind of transformation that we have seen, especially in the health sector also. If we look at the futuristic technologies that we are now adapting, so for example, AI, how is it changing the face of the Indian healthcare sector, or how do we intend to rapidly match up with the other countries who have advanced in the use of AI in transforming the healthcare sector?
Fortunately, India has been at the forefront of using technology even for healthcare. For instance, our teleconsultation. We have a teleconsultation service by the name of e-Sanjeevani. On an average, every day, more than 3 lakh teleconsultations are happening across the country. 3 lakh per day. When we tell this to the Western countries, they are amazed, because they may be having 3 lakh in a month. And this number is increasing every day. Even during this Ayushman Bhav campaign, in these few days, we've already had more than 11 lakh teleconsultations. So whether it is teleconsultations, or we have tele-lines where people can share their problems. Telemanas is a helpline for in the mental health segment, or whether it is the digital mission. How India has been at the forefront of leveraging technology for healthcare. So even in the digital health mission, as I said, we're going to create a nation where all health facilities, all individuals, all healthcare providers, all healthcare professionals are going to be digitally mapped onto one platform. It's a major thing. It's not been done anywhere in the world. As far as AI tools are concerned, we are definitely looking at it. But AI has its own limitations as far as healthcare sector is concerned. It can be good for maybe surgeries or some kind of treatments. But in diagnosis, it may have a limited role. Maybe it can do preliminary diagnosis for certain kind of ailments just based purely on some statistical input. But in healthcare, one has to many a times go just beyond the statistics. So a lot of new things are happening. India has also taken the lead at the global level in the global initiative on digital health. WHO has only last month, when the G20 was held for the health ministers meeting in Gandhinagar, WHO has launched this global initiative on digital health with India as its main partner. So it's a great honor for the country that as far as the digital health globally is concerned, India has been recognized by WHO as the leading country. And once the framework comes up, we are hopeful that India will get a prominent place in this global initiative also. So far we've done quite well, but technology is changing so fast. We are also kind of adapting ourselves with every change, and seeing whatever is beneficial for the citizens of this country, we'll definitely adopt.
Absolutely. And with the aim that the Prime Minister has set for India to become a developed country by 2047, we need to constantly evolve, health sector being one of the primary sectors in which we will have to keep transforming. So that having been said, we'll have to wind up the program here. Thank you. It's been a delight to have you with us on this telecast on Sansad TV.
Thank you, ma'am. Thank you very much.
So that's it from us on this program, viewers. Thank you very much for your time as well.